federal government is making major investments in healthcare across Ontario, announcing a new $3.1 billion agreement today. And joining me live now is Prime Minister Justin Trudeau with an exclusive first look at this deal that has been reached. Prime Minister, good morning. Thank you for joining us.
Thank you. It's a pleasure to be here.
Yeah, we'll start off with the healthcare deal. You're going to be announcing it in a couple of hours here, 10:30 Eastern Time officially. But in Ontario, this investment, $3.1 billion over 3 years. Can you tell us exactly where this will be going and how that impact will be felt here in Ontario, hopefully immediately?
Well, the federal government stepped up last year with a commitment of close to $200 billion across the country in various ways. One of the things we recognize is there's different challenges right across the country in terms of what the priorities are. So with Ontario, we've worked on improving support for healthcare workers. So that means more access to family doctors, but it also means things like faster credentialing for foreign workers to make sure that we can fill those ERs where there's crazy delays, make sure that in rural or more remote places there's healthcare staff showing up for that. So that's one of the things that we're investing in. The other one, mental health. We know access to mental health services is way too long, way too sparse across the country, further regions like Northern Ontario underserved, with a special emphasis on delivering mental health care to youth as well, where it's really key. And the third big bucket is around modernizing our healthcare systems. Getting rid of the fax machines, for example. We've all seen doctors' offices and hospitals that still rely on fax machines. We need to digitize, we need to modernize. We need also to collect better data so that the federal government with its investments, but mostly so Ontarians can see the real tangible results of the investments and improvements from the federal government and the provincial government, so we can actually tangibly feel results from these investments. And that collecting data and transparency is the cornerstone of the federal investment, because we don't get to tell provinces how to deliver health care. That's a provincial area of responsibility, but we get to make sure that the results are being felt by Canadians, and that's how we use data.
Now, as you said, you don't get to tell provinces how to deliver that health care, but when it comes to this investment, are there any conditions on the funds, especially considering that in the last year here in the province of Ontario, there has been legislation that's been passed to move some publicly funded procedures to private for-profit clinics. Any kind of conditions on that?
At the core of every dollar the federal government sends to Ontario or any other province needs to be a commitment to maintain our public healthcare system. We need to make sure that everywhere across the country, the quality of services, the speed of services has no influence by someone's socioeconomic level or income level. That is essential. Every step of the way, we will always fight for our universal healthcare system.
Okay, and you're stressing the importance of the universal healthcare system. Do you have concerns with that move to have some publicly funded procedures in private clinics?
We have increasingly seen particularly conservative premiers across the country experimenting with more private services. The federal government has a responsibility, and we have in the past pulled back transfers from provinces that have gone too far down the privatization road, because we need to make sure the integrity of the Canada Health Act and the strength of our publicly funded healthcare system holds. One of the things we see is sometimes people are saying, oh, well, it'll be better services for some if we allow for privatization. We need better services for all. And that's the thing the federal government's focused on.
Okay, so you're not saying that you won't pull back funds if it goes that way.
For example, this $3.1 billion boost investment we're giving over the next 3 years will be renewed or renegotiated 3 years from now. And we will look very carefully at how this was delivered, whether it made real differences, whether they hit the markers that the Ontario government has committed to hitting. I mean, they know how important it is to improve healthcare services for Ontarians. So we're working with them to make sure that they're able to do that. But there are checks and balances in the system to make sure those improvements happen.
All right, staying with healthcare across the country now, pharmacare. We heard from NDP leader Jagmeet Singh earlier this week that you did have a meeting with him, a closed-door meeting, where he did warn of repercussions if there is not a pharmacare deal reached between the Liberals and the NDP by March 1st in particular. That's just in a couple of weeks. How realistic is it that you'll be getting that deal done by then?
Very realistic. We've been working extremely constructively, extremely positively on both the legislation and some other elements that go with it. We demonstrated how well we can work together when we moved forward as a government on dental care. Right now, 400,000 kids last year got access to dental care that they hadn't had before. This year, we've already seen 600,000 seniors signing up to the Canada Dental Care Program. And this is something that the Conservatives, for example, voted against. So we're happy to work with the NDP and with other parties on delivering things that Canadians need, and we're going to continue to. I mean, I was just talking with Canadians last night in Durham, where there's a by-election coming up, and the issue of being there to support people on affordability, on things like childcare, where we've cut fees in half, and there's more work to do to create spaces, on things like standing up for the rules-based order in Ukraine, and on delivering things like dental care to seniors. People in Durham, like across the country, are really interested in what we're doing.
Okay, are you concerned that if March 1st, if it doesn't, if you don't come to a deal that the NDP does accept and does think that is appropriate for this pharmacare, is there a concern that your supply and confidence deal with the NDP will fall through and leave the Liberals vulnerable?
We're going to come to an agreement.
You're going to do it by March 1st.
We're serious about delivering for people, and being there on pharmacare is an important piece of it.
Okay. Now, we're going to move on to popularity. I know you've been asked this question many times throughout the last few months, considering that when it comes to the polls, a recent Nanos poll as well that went out this week saying that the Conservatives are up at about 40% support. The Liberals are about 15% back here, only just a few percentage points away from the NDP. When you see polls like that, do you have a plan now in order to regain the confidence of Canadians, specifically those who did support you over the last couple of elections and now are reconsidering for the next one?
The world is in a really tough place right now, and it's hard for Canadians. Grocery prices, difficulties with housing, there are a huge number of pressures that we are very much working on, increasing more competition in the grocery sector, building more housing. We've signed a housing accelerator agreement with Toronto worth $500 million just before Christmas to accelerate things. So we are working on all those things, and we're going to continue to focus on that. In terms of polls, we were way behind in the polls before the 2015 election, where I won a majority. We were way behind in the polls before the 2019 election. We were way behind. Polls go up and down. What is really important is that Canadians are focusing on how we work together to build a better future and take seriously the opportunities to make choices about the future. And quite frankly, the proposals and the approach that Mr. Poilievre is taking, and we're seeing it on the ground in the Durham by-election, but we're also seeing it across the country with Ukrainian Canadians really upset that Pierre Poilievre turned his back on the support of Ukraine in the House last week by voting against a modernization of a deal, free trade deal that Vladimir Zelensky asked for. The standing against dental care, the proposing cuts at a time where people need investments in the future, in jobs, and things like the battery plant in St. Thomas that we brought in for Volkswagen, like investments in Northern Ontario that we're moving forward on. There's going to be a really important conversation about what kind of country people want to live in and where we're going to go. But that's not going to happen for probably another year and a half for the election. And until then, I'll let other people worry about polls. I'm going to worry about fighting for Canadians and delivering for them every day in a very tough situation for them.
All right. Lastly, you mentioned Pierre Poilievre and the Conservatives. They have been running on a campaign about Axe the Tax, talking about the carbon tax as well, so carbon pricing, something that the entire country has been watching. And it seems as if there's a little bit of a disconnect in terms of what it is and what Canadians are getting out of it. Do you think you would have done something differently in terms of introducing this carbon tax in order to educate Canadians about exactly what it is and how they benefit or how much more they pay out of it when it was established? Well,
let me take the opportunity right now.
Yeah.
We brought it in as a way to both fight climate change by putting a price on pollution, so businesses would make investments that would upgrade their machinery and do things better, more productively, and cleaner, and return more money to middle-class families so they're not carrying the burden. So every 3 months here in Ontario, Ontarian families get a Canada Carbon rebate, basically a check for the price on pollution that, on average, puts more money back in their pockets. So when Mr. Poilievre talks about killing the price on pollution, axing the tax, he's not only talking about doing less to fight climate change and prepare for the economy of the future, he's also talking about taking away those checks for hundreds of dollars that families get 4 times a year here in Ontario and in other jurisdictions. That means they're actually better off while we fight climate change in a way that is bending our emissions down faster than any other G7 country. The fight against climate change matters. We only have to look at the wildfires every summer to see that. But building a strong economy for the future matters as well. And that's where companies like Stellantis, Volkswagen, companies across the country are looking to invest, because we're leading in a clean electricity grid, but we're also creating jobs and careers for the long term in a cleaner economy.
Are you hoping to rebrand that to help people
we're
understand?
just going to continue to talk about it. There's a lot of misinformation and disinformation out there. Mr. Poilievre hasn't talked once about the fact that he's going to be cutting those checks to Canadians as he cuts the tax. He's talking about cuts to what we need to do to build a stronger future. We're going to keep doing the hard work of building that stronger future.
All right, Prime Minister Justin Trudeau, thank you once again for joining us here on BT. We do appreciate it. And of course, that announcement, the official announcement of the health care deal that has been reached with Ontario.
In a couple of hours.
In a couple of hours at 10:30 Eastern Time. Thank you so much for that.
No, what a pleasure
Appreciate
to be
it.
back, Tammy. Thank you.
All right. Right now.